The Micro I is a handheld diagnostic spirometer that enables baseline and post-bronchodilator forced spirometry maneuvers to be performed with a choice of predicted values, interpretive algorithms, quality assessment of each maneuver, or alternatively configured to be fully NLHEP compliant. Thank you for taking the time to watch this CareFusion Respiratory Diagnostics instruction video for the Micromedical Micro I spirometry products. This presentation will demonstrate the initial instrument setup as well as the preparations required before performing real measurements. As with most pulmonary function measurements, coaching a patient through the testing maneuver in the correct manner is very important, since it is a core influencing factor for good quality data outcomes. Hence, in this e-training module, we'll show you how to correctly instruct the person performing the breathing maneuvers. Please click on a topic or use the arrow buttons in the lower left-hand side of the screen to proceed in the set order. The Micro I spirometer is supplied in a white cardboard box and includes 2 multi-language manuals. The hard-shell carry case contains a Micro I spirometer and all necessary accessories. Inside the case, you'll find the Micro I spirometer, a mains power supply, turbine transducer, power adapters, USB cable, and disposable one-way mouthpieces. To connect the turbine transducer to the Micro I, simply slide it into the transducer mount and twist it into place. The spirometer can be used with either a pulmonary filter or alternatively with a disposable mouthpiece, in which case the mouthpiece adapter should be connected onto the turbine and then the mouthpiece placed into the adapter as shown. Prior to use, we recommend that you fully charge the Micro I. To charge the unit, connect the USB cable to the USB port on the power supply. Slide in the power adapter, which is country and region specific, and then connect the USB supply to the base of the unit. The display will indicate charging. Prior to using your Micro I, we also strongly recommend that the unit is configured to your own personal or practice spirometry requirements, including the language and indices you wish to measure. Customization can be performed either manually on the unit by selecting settings from the menu or through the PC configuration software. Insert the Micro I CD into a free drive on your PC and follow the installation instructions. When the software program is opened, the main window will provide options to configure the device or set the date and time on the unit. The PC software language can be changed by using the drop-down arrow in the right-hand corner and selecting another language. The settings menu allows the language, height and weight units to be altered by using the drop-down arrow and selecting your requirements. A maximum of 4 indices can be selected by clicking in the box next to each indice required. Other options allow a prompt for a daily calibration check, a quick examination without predicted values to be enabled or disabled, and also display NLHEP, that's the National Lung and Heart Education Program, quality grades for the test session. The device may also be set to allow only NLHEP rules for spirometry devices. Only FEV1, FEV6, and the ratio FEV1, FEV6 are displayed and stored. Quality checks are also applied to every maneuver, and a quality grading score for the test session is displayed. To ensure optimal test results prior to performing spirometry tests, patients should be advised to avoid certain activities, such as smoking, consuming alcohol, performing vigorous exercise, and eating a large meal, all within specific intervals before the test. The current ATS/ERS 2005 guidelines provide the following advice on contraindications for performing spirometry. Patients should not be tested within 1 month of myocardial infarction. Suboptimal spirometry results are likely in individuals suffering from chest or abdominal pain, oral or facial pain, exacerbated by a mouthpiece, stress incontinence, dementia, or confused state. Before testing, ensure patient's details are correctly entered or recalled from the database. The patient should be relaxed and dressed comfortably. Make a note of the patient's current medication. MicroGuard filters have a 99.99% bacterial and viral efficacy and should be used as part of spirometry hygiene and cross-contamination procedures. MicroGuard filters can be connected directly to the turbine. Alternatively, if a disposable cardboard mouthpiece is used, the adapter supplied with the Micro I should be wiped using a disinfection cloth before use with a new patient. CareFusion can supply filters with a round mouthpiece or an oval mouthpiece with teeth guide marks. Filters can be supplied on their own or in a pack with a nose clip, thus providing a single patient-use disposable set. The Micro I spirometer main menu enables tests to be performed for quick examinations without predicted values or with predicted values. To obtain predicted values, the patient's age, gender, height and origin need to be entered. Use the up and down arrow keys to change the default and then press Enter. Once complete, the patient's blow legend is displayed in preparation for a test. The Micro I will display the blow legend. Prior to performing a test, ask the patient to place a nose clip on their nose, take a maximum inspiration, and then place the mouthpiece in their mouth, ensuring the patient presses the lips firmly for a tight seal from the lips. The patient should then exhale as hard and as fast as possible for as long as possible. Encourage the patient throughout the process to ensure maximum cooperation and effort. To repeat the test, press Enter and choose Blow again. The test should be repeated to obtain 3 good blows.
Keep going, a little bit more, keep going, and breathe.
The Micro I will display results as percentages of predicted values, as standard deviations, or as Z-scores, depending on how the unit has been customized. When all maneuvers have been completed, return to the main screen. The post-bronchodilator test will allow you to compare the spirometry results before medication was administered with those after medication. From the main menu, select Post-BD Exam. The display will show the last test with the date. Select a base test, then hand the Micro I to the patient and ask him or her to perform a maximal inspiration followed by a maximum expiration. Help the patient by spurring them on through the process. Repeat the procedure 3 times. Once complete, press the main menu and scroll down to Last Results. The display will then show the post-DB results as a percentage change from the base test that was performed. Thank you for watching this presentation. As you'll have noticed, good quality results very much depend on coaching patients to perform the maneuver correctly. The American Thoracic Society and the European Respiratory Society have clear guidelines on how to perform spirometry testing. It's recommended that operators are thoroughly familiar with these guidelines, but do note that local guidelines may also apply. It's recommended that only CareFusion accessories should be used with the Micro I. For advice on accessories or any technical support questions, just contact our dedicated support team or visit our website.